Hey everyone, it's Dr. Martin, your host as usual, every Tuesday at 12. I want to welcome everyone from Einstein Peds for coming, and those who aren't Einstein Peds, welcome to come as well. I think we're on week 7 of doing these, so I hope you're finding them useful. I certainly love doing them, and I'm glad we've been able to find a way to reach out to you guys as many of you still are staying at home most of your days, although things are loosening up a little bit as we move into phase 2. I will let you know next week, May Ping will be coming on and speaking about potty training. So those of you who haven't met our nurse practitioner, May, definitely come on next week to check us out as we talk about the dreaded potty training, probably one of my least favorite things doing with my own kids. So I know it can be a real challenge. But today we're going to continue our ongoing discussion with COVID-19 and some of the issues with anxiety and stress at home that are certainly dribbling down onto our kids and they're experiencing. And I thought you were probably tired of hearing me talk about it, and we bring in the experts. So I'm happy to introduce Dr. Emilie Paczkowski, who is from Children and Family Associates, who's agreed graciously, and I really appreciate it, to come today. And speak to us a little bit about the anxiety we're experiencing with our own kids, in particular school-age children. So on that note, let me bring her into our stream here. And here she comes. Hey, how are you?
Hi. Good, how are you?
Good. So I should mention, you are a licensed clinical psychologist. Working with the group. So a lot of times families get confused even with us in terms of our different credentials. So you are a doctor. You have done 4 years college and then all that extra training and debt that we all get from doing it. So a lot of years go into what you've done. Mm-hmm. And so thanks for coming. Appreciate it. I'm sure you guys are keeping busy with all of this. Now, are you seeing patients only by telehealth? I didn't ask you that. Or are you doing in person at this point as well?
We are doing all telehealth. We converted over as of mid-March, and it's really been a smoother transition than we would have expected. The sessions are going quite well, and we've actually had a number of previous clients returning for services during this time, and lots of new referrals starting to come in as people have understood that we are doing telehealth. So we're still going strong with that, and still trying to figure out when it would make sense to return to in-person sessions in the office.
Sure. I've been doing a lot of discussions about school starting up, which is probably a whole nother area of anxiety creating for parents and families. So I think we're all kind of feeling our way through it, and things are sort of moving targets, so things change. So appreciate I'm sure your patients that you see and families appreciate you making yourself available. So I'm just going to jump in if that's okay, and we can start talking about some of the issues that certainly we've gotten questions about. So first one, there's a lot of uncertainty going on, just like I was mentioning with school. We don't know if school's starting, pools opening, camps. A lot of camps have been canceled. Some are actually still going in some kind of limited operation I've seen in some states. But this has been hard for parents because many are still working. They're trying to occupy their kids with activities and things while they're doing, while they're living other components of their life, and it's a challenge, and that's certainly building stress up. And I just wondered how, with your families, particularly for the school-age kids, how you're helping them deal with some of these stressors and unknowns, really, about what to do.
Sure. Well, yeah, at Child and Family Associates, it's right in the name, the family piece. We often are working with families to navigate difficult situations and topics. And when it comes right down to it, I think we all, as parents, when we see our kids feeling the loss of a camp that got canceled or just uncertainty about, what the summer is going to look like, we want to fix it. And that can kind of create, a loss of an opportunity for a connection there. So one of the things that we often talk to parents about and train them in doing is, that active listening. And one of the, best ways to go about this can be, following the mirroring, validating, and empathizing rule. And, to do that, a parent can simply, sit down with their child who's, kind of trying to process all of this and reflect back what you heard them say. That's the mirroring. Validating, letting them know that you can understand why they would be thinking or feeling that, from their perspective, even if you don't agree with it. And then empathizing, I can imagine how it would feel, scary, or how you'd feel sad. And then, that's opening up a dialogue, to really talk about what's going on for them. When it comes to a child who, for example, their favorite summer camp that they've been to for years has been canceled, you know, we might think we understand, what that loss is all about for that child, but there might be aspects of it that, we're surprised by. So particular activities that would happen, in the normal summer schedule, can you try to replicate those if that's it? For another child, it might not be the activities so much as the connections to kids that don't live in the area who they only see at that camp. Then, is it possible to reach out to set up a Zoom call? So really just trying to kind of work with your child, even the younger kids, to problem solve together so that you're not kind of missing the boat on trying to, recreate their summer for them in a new way.
Sure. No, that's great. And I think all of us, I think many of us parents were having our own cries when we saw that our kids weren't going to be able to go to camp. But we're constantly trying to find solutions, and we forget the listening piece. And I'm probably as guilty as anyone. I'm a problem solver, and you want to solve things. It's like, okay, we have to address this, very goal oriented. And I think for a lot of us, we are. So just stopping and talking to your child and listening probably is really valuable advice. I think the other thing that's been a real challenge, and I can say just for myself too, is it's that things are changing, and it's like expectations keep having to change. And I think helping kids deal with the fact that something they counted on suddenly can shift. Are there strategies to help them in anticipation of some of that? Are there strategies
Sure.
you employ in doing that?
Well, sure. Yeah. I mean, flexibility is something that we end up talking with a lot of kids about. It's, particularly difficult for some kids, with ADHD diagnoses. There's problems with shifting from, being on one path to shifting over to another. Also, kids with anxiety can have difficulties being flexible because they, kind of, amp themselves up about what's going to happen, thinking about, the next steps. And then when the plan changes, it can kind of throw them, into turmoil. So, I think building, flexibility is, something that, can be a lifelong pursuit for many of us.
Yeah.
But, just sitting down with your kids and, helping them, when you're not in the middle of the situation, just say, if that happened, and we couldn't do this, what could we do instead? Practicing, even generating multiple types of solutions to a problem, or just thinking through, if you anticipate something might be changing, is there a plan B? And how do we get kids to kind of get used to thinking about a plan B, and thinking of the secondary option as not like less than, or, like I'm losing out, but just something that's different. How do we change that narrative so it doesn't feel, so stressful when it happens?
Yeah, it's funny. Yeah, I guess in some ways it's an opportunity for us, life lessons here, right, for the kids. And I think that's reframing. I think even for us pediatricians, as things change and in all of our jobs, it's like it's an opportunity to try different things, like Facebook Live. And so yeah, no, I like that approach. I think turning things into a positive strength building. I mean, it makes
Right.
sense. It makes sense. Um, Now, I will say, gosh, I think it was I noticed on last Thursday, I looked at my schedule and I realized about a quarter of the patients I were seeing were actually mental health issues. And so there's been a real shift. I'm sure you're starting to see it. So it is a common question I get, a lot of kids are experiencing anxiety and stress, but what are the signs the parent, obviously they should be talking to them, talking through the feelings and listening to what the child has to say, but what things should cause a parent to take it more serious and take more action, either reach out to us as pediatricians or reach out to folks like yourself in the mental health field.
Sure, sure. Yeah, and and we often also get calls, at CFA, our referral line can often be filled with people who are like, I'm not sure if this warrants treatment. How do I make that decision about this next step? So the, big thing that we would always talk about would be like the concept of functional impairment. So those are, things like the major problems with sleeping or problems with eating, changes in those patterns that, might be red flags. Also, increased difficulty connecting with friends or family, being more likely to withdraw. Also, things that might be a little less of a tip off, but you want to watch out for kids who all of a sudden seem more resistant to following instructions. Just, maybe a little more irritable. Sometimes that, uncertainty, can increase that need for control, and that can be a sign of underlying anxiety that's getting too much for the child to handle, that they're trying to, control their environment by resisting rules or getting overly perfectionistic, things like that, that maybe you want to question a little more, and sometimes these might be things that you've been seeing throughout the child's life, but now all of a sudden it seems to be really getting in the way of them doing things that they would normally be able to do. Um, and in that regard, even, activities that a child previously really enjoyed, and all of a sudden you notice that they don't want to do it, or they do it and they just don't seem to get much out of it, or to, feel the reward of that activity the way they used to. Those can be signs, that there's some, mood difficulties coming in there, possible depressive symptoms. So, we want to be on the lookout, even when it's not, those big things like, my kid can't sleep, but just, changes in how their parents are observing their kids' behavior.
Yeah, it's tricky. It's a lot of times, I mean, it takes a little while to realize it can be very subtle things, bedwetting, it can be just changes, something that hasn't occurred for a while that you don't make the connection. And even the kids aren't, they're not connecting it either. It can be physical manifestations. Yeah, I mean, it can be really tricky and challenging, but yeah, I would definitely second that. Please reach out to us. And I would, for the families out there listening, it's like, you can portal message us 24/7, and then we're open 7 to 5 to call in. So if you do have worries about some of these things that Dr. Paczkowski has mentioned, please reach out to us, because I think that's important. If the thought's there, I usually find if you're thinking about it, it's probably worth making the reach out. I think usually people wait longer than is optimal, as they start to question themselves about, they don't want to bother. But I think it's important for people to know, like, you can reach out to us about that stuff. And if it ends up being something we're like, it's something else, that's great. We're happy that it's not. But they shouldn't feel they can't reach out to us, as well as, not just therapists and psychologists, but us as pediatricians as well. And I don't think people always realize that. Good. So this was one that and for those of us just joining, I probably should introduce you again, because I know people join in midstream. So we're interviewing Dr. Paczkowski from Children and Family Associates, located in Falls Church. She has graced us today and to talk to us about anxiety in school-age children and things to look out for and things that we can do. So really super appreciative for you being here. You reached out to me as I kind of sent out some things about things to discuss, and I'm gonna throw it out there because I know it's a big one, but it's probably hours and hours of conversation to really get the full into the meat of it. But so about media in general, and so that really branches social media, television, iPads. I mean, it's a huge, but it's become, and I'm as guilty as anyone, it's become kind of a need in our household, especially as I'm working and my wife's working, to occupy some of the time of our kids. And I guess I would, what should the role of it be? How do we make it work for us. I know I had mentioned before in one of these Facebook Lives, it is interesting in the research that I've seen, and maybe your research in the psychology world is different, but there is, especially social media can be very helpful for kids and adults, but it's how much you consume makes a difference in that benefit. And so from what I've read, 20 to 30 minutes a day seems to be the magic spot. Doing more than that, where it starts to become consuming, worried about what's the person going to say, other people are going to say, what are their friends doing, that becomes the consumption where they're constantly looking, adults too. So yeah, I wonder if you could, broad topic. We can start with social media. I think social media has been helpful for kids to reach out to their friends. What do you think is how should parents approach this with their kids in terms of limitations and rules and what kinds of social media that they should be able to consume?
Sure. Yeah. I think that it's a very personal decision that families have to make. But, certainly as kids age into that range where their friends are starting to have social media accounts, what I've seen be successful for some parents in navigating this is to say, okay, if you want to have an Instagram account, great, let's do that. But I need to be one of your Instagram followers. I need to be able to see what you're posting, and understand who you're connecting with. Making limitations on who you allow your child to connect with on social media based on whether this is a person they know in real life, have actually met before, kind of verified people. And those things can kind of limit that exposure where your child's kind of connecting to the whole world. But I think also, what I've seen from some kids is, as you indicated, there's this anxiety associated with what people are going to say, and kids who maybe were having some challenges in school, with kids they would interact with where there was tension or, bullying, just generally negative comments or things that they would have to endure in the halls. It's been a nice reprieve to, be at home and be away from that. But then if you end up connected on social media or you see that someone spread a rumor in that venue, it's kind of like it's back there and we've lost all of those benefits of kind of being out of that environment. So I think what you said about that 20 to 30 minutes a day, and then parents really having an understanding going into it that there will be a degree of monitoring, and I would say honestly, like waiting till we're closer to those maybe tween but teenage years before you're really allowing a lot of that social media in. Um, and if it is about connecting to specific friends, there are other ways to set up online interactions outside of uh, the actual social media apps or things like that. So that can be a nice alternative that maybe doesn't open up the rest of that world.
Yeah, I think that's great. Now, the other thing I try to tell families is it is easier when you one is to set expectations before you go forward, right? Set up the rules. And it is always easier to give more than it is to take away. So don't start big.
Absolutely. Parents, this is a broader point, but, we always want to get them in the position of being the person who gives privileges rather than feeling like they're constantly taking things away. So having your children, earn those privileges through showing that they can be responsible and make good choices is another way to kind of, naturally limit and make sure that your kid's ready.
Yeah, absolutely. So that's social media. I agree with you, like too. I think it's been very useful. Like we do that with our kids. We have like Zoom where they get to talk to the grandparents or to the aunts and uncles, and we do a little bit of that as well. So occupying those days in terms of gaming and computer games, how do you approach that with families?
So, I feel like most of the time when I'm hearing about computer games, it's, as you had indicated before, when things are kind of far gone already, when kids are already spending so many hours on the games, to the exclusion of other activities. And that's where, again, rather than sort of getting yourself in this position of just always kind of using that as leverage or threatening to take it away or things like that, coming at it from the perspective of, we want to plan out our day or plan out our week. What are the different types of activities that you want to see your child include in their day? Is there a way that you can work with them to create a schedule that sort of naturally limits the time that they're spending on an activity like a video game, in favor of adding in that, family walk or a board game or something like that. And again, we go back to that first point of trying to make it a discussion. Maybe having a whole family meeting where you sit down and you talk about the role of different types of activities in the daily schedule. And that can feel good for the kids to feel like they're a part of that, rather than, again, it's just kind of a top down process of limiting or defining what the hours are.
Yeah. So I'll say one of the challenges, I'm going to give my experience too, is like I have a 14-year-old. One of the challenges has been the merging of the social with the gaming, and they're
Right.
actually having conversations and how do you interpret? I mean, like it's not like just passively consuming. Do you have recommendations in terms of how much of that? I worry, I do worry with media. It's like for a lot of kids, it's it's an escapist sort of thing, right? But when you have the social interaction that's being limited out in the world, and this is one way that they're actually able to. How can you give us guidance? What you suggest, or how you control some of the consumption of that, or how much you think is okay, what isn't okay?
Sure, sure. I mean, I'm always hesitant to give, a specific number of
Yeah.
hours, but I think, if your child has, kind of a well-rounded range of things that they're doing and different ways they're connecting with people, in an hour or two tops on a game like that should be, more than enough in balance with everything else. And I think that here again, the question of like who are kids connecting to on those games is really important, because I hear from some kids who it's, well, I have this specific group of friends and we make a plan to all get on and play this game together. And then, you can really feel better about the idea that that is a way of being socially connected to friends versus someone who goes online and you can hear them on the headset, but you don't know who they're connecting to, and they might just be connecting to random other people on the internet who happen to be playing the game at the same time. And then you run into all sorts of other issues of how old are these people, what kind of language are they using, what are they talking about that maybe you don't necessarily want your child exposed to.
Yeah, it's really tricky. And some of the advice I've given, I do with my kid, like I want them consuming in areas where we can see and know they're not behind
Right.
closed doors.
Right.
I think that's where a lot of families get into trouble. They don't know what they're consuming. They just know that
Absolutely.
even if they give them time, they're not really aware of what's going on. I've even gone as far as, which I like games too. I mean, doing some of the activities with them to see what they're doing and what they're talking about. It's another way of engaging, right? So, I mean, I've even gone so far as that, if that's an option for families, just to be aware of what they are doing on it.
Right. Right. And yeah, I don't think that, any of these, ways of using screen time, there's no absolute good or absolute bad
Yeah.
necessarily. But, the idea that all of these things can be used as a venue for social connection rather than, as you indicated, that escapism or that, means of withdrawing.
Yeah, no, absolutely. I appreciate it. That's a tough one. I feel like that I will probably talk about many, many times over and get new
Mm,
insights into it. So one of the things you brought up, which I would love as our kind of final note, and I'm seeing it all over the place, and it's everywhere I'm seeing, we're making recommendations from the medical community about what people do in terms of face masks, what they should be able to do outside in terms of social distancing, and what they shouldn't do. And then you see a lot of people just making up their own rules. Their own guidance, right? And then we have to look to our kids, and our kids are like, what the heck's going on? What am I? And even with the media, it's like you're getting very things all over the place in terms of what's real, what's not, what the guidance actually is, what the, what you should or shouldn't do. Navigating that with kids can be challenging. I don't know if you want to talk a little bit about like some, because I know that was something you had brought up that you're experiencing with the families.
Right, right. I think, it's important to keep in mind that, kids are looking to the people in their environment for their guidance on what to do in most cases. You're not going to have an 8-year-old who's, picking up, the latest report from Johns Hopkins or, something like that.
Right.
So, with younger kids, what are their parents doing is one of the things they're going to see. So, if, mom and dad put on a mask and, make that a normal thing, then, the kid's going to be more likely to be, open for that. When it comes to teenagers, but younger and younger nowadays, it seems, you get that shift towards being more peer oriented. So, what mom and dad do in some cases might stop carrying as much weight, and you want to be aware of, what are their friends doing? What are their friends talking about? And, when you, make a decision for your child to interact with, a child from another family, do you know kind of where they stand? And, are they going to, if your child goes over for a socially distanced play date, is it really going to be socially distanced? So there's just a lot, again, of kind of being informed about what your children are seeing, and then making it a really open thing that you talk about, and that you give your kids the, the benefit of, the explanation of why, that it's not just we're going out, we wear a mask. Well, why do we wear a mask?
Right.
There's a lot of, great, stuff online. You can find like graphics and, visual images that are going to help your kids understand why you're asking them to do things rather than just, telling them it's what they have to do.
Yeah, no, it gets back to listening to them, right? It's like, what do you, with a lot of conversation, like a lot of times people come to me, and I'm sure with you, like asking, how do I talk to my teen, and how do I, I want to know more. And sometimes it's just a matter of like listening and just asking, well, what are you seeing about this? What do you think about this? Starting the conversation there. But yeah, it's definitely a challenge though, because I will say even my own kids have certainly asked, and we're like, why? Like everyone's doing different things at this point, and it's getting worse. So from the medical, I'm going to say you should still be very cautious in wearing face masks to prevent droplet spread, and I would limit direct contact and still do social distancing, because I can tell you the hospital still has hundreds and hundreds of cases. So it's decreasing, but it's definitely not gone. It's still all around us, and I can tell you in the yesterday we had a couple. I mean, we're doing testing still in the office from probable cases, so we're still seeing a fair amount. So people, please take precautions and stay vigilant. I know it's tough. Well, I want to say thank you for being here. This was awesome, and I really, really appreciate it. And again, for those who may have joined midstream, this is Dr. Paczkowski from the Children and Family Associates. I'm putting up their website. They are open. They are doing telehealth. We will certainly still absolutely refer to you, but I want families to know that they can reach directly out to you as well as they need things. And thank you so much. This was awesome, and hopefully we can do it again, maybe on a different subject. But I really, really appreciate you joining us today and providing great insight. Thank you.
Thank you so much.
All right, take care.
You too.
All right, guys. So this is going to be our wrap up. So again, next week, I just want to remind you that Mei Ping, our pediatric nurse practitioner, will be joining me to talk about dreaded potty training, try to make it easier for you and get you through it. Following that, I'm hoping going to have someone actually, a speech therapist, speak and talk to us about introducing foods and early introduction of solids and feeding those challenging toddlers, which I'm looking forward to because I know that's a topic that we run into a lot in the office, and I know there's lots of good information that we want to get out to you about that and make that easier and go smoother for families. But again, I want to thank all of you for joining us, and Dr. Paczkowski again for making the time out from Children, Family, and Associates to speak with us today. I hope you all found it useful. I certainly did. And I am definitely looking forward to coming back next week and having Mei Ping here to talk again. From Einstein Pediatrics, all of us at Einstein Peds, I want to wish you well and safety. And please, if anything does come up in the interim about these worries, about anxieties with your children, remember you can always reach out to us by phone as well as through the patient portal, which comes directly to the providers. So be well, everyone, and take care. Bye.